You are about to begin a new road on your cancer journey, and we are here to help you along the way. Cancer can be treated in many ways. Some of the most common methods are chemotherapy, biotherapy, or immunotherapy. This video will walk you through the treatment process at MD Anderson. Before you begin your cancer treatment, you'll meet with a member of your provider team to talk about the treatment. You'll learn about your treatment type and discuss how often and how long it takes. Cancer medicines help your body fight cancer cells. However, sometimes they can also cause side effects or make you feel sick. You'll get information to help you learn how to manage any side effects. After you review your treatment plan, you'll be asked to sign an informed consent. The goal of informed consent is to make sure you understand the treatment plan. This is a great time to ask questions. Tell us your concerns. We are here to help. If you're on a clinical trial, a provider team member will review the details of the trial during this appointment. Again, feel free to ask any questions. Your provider team sends an appointment request to the Ambulatory Treatment Center, or ATC. Once received, the ATC staff will schedule your appointment times on MyChart. You'll receive an email to verify that appointment. You may receive your treatment in any one of the ATC locations. Your provider team will discuss the location of your treatment with you. The location depends on availability. This means you may go to more than one location for your treatment. Business hours are different for each ATC location. You'll meet with your provider often to review your progress and health. It is important that you keep your body as healthy as possible. Your blood counts are checked often to help monitor your health. You may have blood tests before each of your treatments. Your provider team will schedule the blood test on the day before or the day of your treatment. Some types of treatment can cause your blood counts to go below normal levels. You may experience anemia, thrombocytopenia, or neutropenia. Anemia means your red blood cell count is low. Red blood cells carry oxygen to the cells of your body. Thrombocytopenia means your platelets are low. Platelets help your blood clot. Neutropenia means your neutrophils are low. These are white blood cells that help you fight infection. You may need a transfusion to help maintain a healthy blood count. A transfusion is a medical procedure where donated blood is added to your blood. We'll determine your blood type and screen the donated blood to make sure you receive compatible blood products. If you have a portacath that you would like accessed for blood draws, talk to your provider team. In some area locations, you may need to schedule this separately. Your cancer type and specific treatment plan may need test results to be reviewed before your treatment. Understand that the results are usually ready in 30 to 90 minutes. It depends on the type of tests being performed. Please have your labs done at least 1 hour before your treatment appointment to prevent delays. On the day of your treatment, go to the ATC location on your schedule. Check in at the front desk or use the self-check-in if available. This starts your appointment process. You'll get an identification bracelet. While you wait for your treatment, the team reviews your orders and lab results. This is to verify that it is safe for you to receive your treatment. If your doctor wants you to have a blood transfusion, the staff will make sure the transfusion consent has been signed. This often requires more discussion to review any questions or concerns you may have about your transfusion. Any patient with a newly inserted venous access device or VAD, either placed at MD Anderson or at another facility, needs to be verified with documentation by a provider. A chest X-ray must be on file to confirm that it was inserted properly and is in good condition. this must be done before you can receive treatment. If any of these items are incomplete, it may delay your appointment time. Once your lab results, orders, and insurance have all been verified, the nurse tells the pharmacist to begin making your medicine. Once everything has been reviewed and verified, your vital signs are taken. This begins the treatment process. You receive your treatment in a room with a bed or recliner. You may have one visitor with you during treatment. No children under the age of 13 are allowed in the treatment rooms. You may have a TV or iPad and internet access. Feel free to bring a book, magazine, or your digital devices. Snacks and a light meal may be available in some ATC locations. Feel free to bring snacks or meals with you for the day. Dress comfortably. Hospital gowns are not available. Wear layers or a sweater as you may get cold. Blankets and pillows are available. Wear non-skid, well-fitting shoes. Bring your own personal care items such as ostomy supplies, trach care supplies, glucometer, and supplemental oxygen. Be sure to bring enough portable oxygen. There is not an oxygen source in the waiting areas. Also, bring all of your current medicines with you so that you can continue your regular doses. Your doctor orders the medicines for each treatment. Before your treatment, you may receive other medicines to help with potential side effects. Your medicine can take up to 1 hour to be prepared. After it is ready, it is double-checked for safety by 2 pharmacists before being given to your infusion nurse. Based on how your medicine is administered, a nurse either accesses your venous access device or places an intravenous catheter or IV in a vein in your arm. Once the medicine arrives to the unit, the nurse begins your treatment. The amount of time for each treatment varies. The nurse comes to your room throughout your treatment to check on you. After your treatment has finished, you may need to wait in the room. This is to make sure you do not have any serious reactions to the medicines. The nurse will tell you when it's okay to go home. You'll meet with your doctor often throughout your cancer treatments. Your doctor will review your progress and overall health. More labs and other tests may be done. This allows your doctor to make changes to your treatment based on your current health. To get the best results, it's important that you follow your treatment plan and schedule. We know this is a new experience for you, and you may be overwhelmed with new information. We understand that waiting is an unwelcome part of the treatment process. It helps to be prepared. There are a few things you can do in advance to help things go smoothly. Depending on your regimen, you may be able to schedule your treatment appointment on a separate day from your clinic visit. Be assured, we are here to help you. You may find these tips from other patients' experience helpful. Get comfortable. Bring all your current medicines. Refer to the chemotherapy guide for information to help with common side effects. Refer to the ATC welcome letter on how to prepare yourself. We understand that your time is valuable and your safety is always our priority. Feel free to ask questions. Thank you for choosing MD Anderson.